Thank you, Pak Indra. Good evening, ladies and gentlemen, distinguished guests and colleagues. It's a great pleasure that I welcome you to the 63rd Knowledge Sharing Session hosted by KSK. Tonight, we gather as a community committed to advancing excellence in healthcare, and our theme this evening is one that resonates deeply with the challenges and opportunities of our time. Why low-carbon healthcare matters. To help us explore these crucial topics, we are honored to have with us a remarkable leader in sustainable healthcare, Ms. Sonia Rochnik, as the Director of Geneva Sustainability Center at the International Hospital Federation. Ms. Rochnik has been at the forefront of driving innovative solutions and inspiring actions to make healthcare not only safer and more effective, but also environmentally responsible. In our world where the health of our planet is an intricable link to the health of its people, the concept of low carbon healthcare is no longer a choice, but is a necessity. From reducing greenhouse gas emissions to promoting resources efficiency and resilience, this approach directly addresses the pressing issue of climate change while ensuring equitable access to care for the future generation. Ms. Rosnick is an extensive experience, Mrs. Rosnick extensive experience and her unwavering dedication to sustainability have shaped global dialogues and catalyzed meaningful changes. Her insight tonight will not only shed light on why low-carbon healthcare is essential, but also guide us on practical steps to integrate these principles into our system and organization. Ladies and gentlemen, let us open our minds and our heart as we prepare to engage with this transformative vision for healthcare. Please join me in giving a warm welcome to Mrs. Sonia Rosnick.
Sonia Rosnick. Okay.
Now, I will share the we have done the opening already. After this, Dr. Johnny will give an opening prayer as usual. Then we have a message, opening message from Executive Chair of CARS, Dr. Sutoto MKS Fisqua, CRP Sihamet. And then we have the main speaker, Ms. Sonia Rosnick, Executive Director of Geneva Sustainability Center, about why low-carbon healthcare matters, followed by question and answer. And we have I'm going to close, and we have a quiz for 10 minutes for people who are interested to get an e-certificate, must answer 5 questions in 10 minutes. And the people who pass more than 80% will get an e-certificate. Thank you. Now we are stepping into the second program, that's opening prayer by Dr. Johnny. Please do.
Okay, thank you, Dr. Hani. Good evening, ladies and gentlemen in Indonesia, and special for Miss Sonia. Good afternoon in Geneva. I'm sorry, we have a custom to start our program, every program in CARS with praying together. I will make a praying in Bahasa. I'm sorry. Yeah.
No, it's fine.
Baik, Bapak-bapak, Ibu-ibu, teman-teman, seperti biasa kita mulai acara kita dengan doa. Saya akan pimpin secara Islam, teman-teman yang selain Islam boleh menyesuaikan. Kita mulai. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Hamdan naimin, hamdan syakirin, hamdan yuafi ni'amahu yukafi mazidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhikal karimi azim sultanik. Allahumma salli ala Sayyidina Muhammad wa ala ali Sayyidina Muhammad. Rabbi israh li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Ya Allah, ya Tuhan kami, pada malam hari ini kami berkumpul bersama dalam acara kegiatan rutin kami KSK Knowledge Sharing Cars. Untuk itu ya Allah kami mohon ridho dan berkah-Mu untuk acara kami. Jernihkan hati kami dalam acara ini. Cerdaskan otak kami dan lancarkan lisan kami. Sehingga materi yang akan diberikan oleh pembicara dapat kami terima dengan baik dan dapat kami amalkan kalau memang itu bermanfaat buat banyak orang. Ya Allah, berikan kelancaran lisan kepada pembicara Miss Sonia Rochnik yang akan memberikan materi tentang low carbon. Ya Allah, hanya kepadamu kami bermohon dan meminta karena Engkau adalah pengabul semua doa. Rabbana atina fid dunya hasanah wa fil akhirati hasanah qina azabannar. Subhana rabbika bil izzati amma yasifun. Wassalamun alal mursalin walhamdulillahi rabbil alamin. Baik, thank you.
Thank you, Dr. Johnny. Now we give our chair to Dr. Sutoto, our Chief Executive Director. Please.
Thank you very much, Dr. Hani. Good evening, ladies and gentlemen. Distinguished speaker, Ms. Sonia Rosnik, moderator, Dr. Hani, and all participants. It is my great pleasure and honor to welcome you all to this knowledge sharing webinar hosted by KARS. Today's event holds special significance as we address a topic that is not only relevant but crucial to the future of global healthcare. Why low carbon healthcare matter? On behalf of KARS, I would like to extend our heartfelt gratitude to our esteemed speaker, Ms. Tonia Rosnik, Executive Director of Geneva Sustainability Center, for sharing her invaluable expertise with us today. Your leadership and advocacy for sustainable healthcare have inspired many around the world, and we are truly privileged to learn from your insight. As healthcare leader, we are committed to improving patient outcomes, but we must also recognize the significant environmental impact of healthcare system. Hospital and healthcare facilities worldwide are major contributor to greenhouse gas emission, waste generation, and resource consumption. These environmental challenges demand urgent attention and innovative solutions to ensure a sustainable future for generations to come. This webinar aims to explore the critical intersection of healthcare and environmental sustainability. It challenges us to rethink our practices, policies, and systems to minimize the carbon footprint of healthcare while maintaining high standard of care. The topic is particularly timely as the world faces the dual challenges of a climate crisis and evolving healthcare demand. Addressing these challenges requires collaboration, knowledge exchange, and a shared commitment to attain a commitment that this knowledge sharing series seeks to foster. I'm confident that today's discussion will inspire all of us to take actionable steps in promoting low carbon healthcare solution in our respective institution. Let us approach this session with an open mind and a shared vision for a healthier planet and healthier future. Once again, I would like to thank Ms. Sonia Rosnik, our also Dr. Hani and organizing team and all participants for joining us today. Together, let us make sustainability a cornerstone of global healthcare. Thank you, and I wish you all a productive and insightful webinar.
Yes,
Thank you
thank
very
you
much.
very much, Dr. Sutoto. Thank you very much. Now we come to our primary, our main main program. That's the speech of Ms. Sonia Rosnik. Please have your time.
Thank you very much, and thank you for inviting me to this knowledge sharing moment. I would like to congratulate you for being on your 63rd knowledge sharing webinar. It's clearly so important to be able to share good practices so that we can keep improving health around the world. So thank you, Dr. Sutoto, Dr. Johnny, and Dr. Hani for that. I'm going to share my screen, and I'm going to try and share some experiences from the International Hospital Federation and the Geneva Sustainability Center. And we'll have time for some questions and answers. But please do use the chat if you'd like to ask questions as I'm going along. If there's something that's not clear, or if I'm speaking a little bit too fast, because sometimes I get very excited about this topic and I can start speaking a lot faster. So bear with me with that. I'm very pleased that you've chosen to address this topic. I think it's clearly crucial in today's world, and it's not always easy to understand how we can all act as leaders in healthcare. So I hope we'll try and explore that together a little bit. Just so that to tell you a little bit about the International Hospital Federation, it is an organization that mostly groups up hospital associations from around the world. And the main aim is really to share knowledge, just like you're doing, amongst leaders around the world. And they obviously choose different topics that are relevant, themes to make sure that are relevant to leaders. And you'll see that the sustainability topic and theme is one that has been prominent within the International Hospital Federation work. And mostly our work is focused on leadership development, knowledge exchange, but also trying to support leaders in healthcare on their journey towards sustainability. So one of the first things that we worked on with the International Hospital Federation is a recognition that the way we look at climate change and what it means to be environmentally sustainable really is something that needs to be part of every aspect of healthcare. And that's what we're going to be exploring today. It's not just about energy in buildings. It's also about quality of care. It's also about how we look at pharmaceuticals and medical devices. So I'm going to try and bring that all together into something that is as understandable as possible, hopefully. So the most important thing, and I'm sure you know this already, is that climate change and our planet is inextricably linked with our health. And what we see around the world at the moment is some real effects on people's healthcare. So as healthcare professionals, it's incumbent on us to make sure that we include some of this knowledge in the way we deliver care and that we respond to it in a careful way. So one aspect is to make sure that we reduce our impact, because some of what we do, and you'll see in healthcare, we have an environmental impact, but also to take into account what our world will look like in the future so that we can be well prepared and help our communities be well prepared, but also plan our healthcare better going forward. And that can be in relation to, changes in sea rising levels. It could be changes in disease patterns. It can be links to air pollution. There are so many different aspects to be taken into account. I know, having visited Indonesia last year, what a beautiful country you've got and how important it is to preserve that as best as possible for the health of your people. And so if you look at this picture on the left-hand side, we obviously all understand that our own health is very much linked to our community health, but it's also linked to the health of all animals and living aspects of our planet and every other health system, be it to do with the sea levels, to do it with the way the winds work. It is all part of one system. And we cannot ignore how they influence each other. The good thing, though, is that there are lots and lots of different ways that we can influence this. And the diagram on the right is trying to illustrate that as healthcare professionals or people who want to work towards sustainable, resilient, healthy people and places, we can reduce our environmental impacts, and we'll talk a bit more about that. We can reduce inequalities in our populations and in our communities. We can reduce the burden of disease. All those things will be going in the positive direction. And there's a lot of things that we can do to enhance our natural environment by planting trees, by looking after our ecosystem. We can also build on all our cultural heritage, our shared community knowledge, and we can build on individuals' independence and well-being to make sure they don't need healthcare as much. All of these elements will contribute to it. So you can see that there are lots of places and lots of things that we can do to improve the sustainability and the quality of our healthcare. And I would argue, and I know ISCO has published a green paper on this, the International Hospital Federation thinks it's important. A lot of the, professional colleges really believe that there is a complete link between quality of care and making sure that we deliver sustainable healthcare that is low carbon, resilient, and equitable. And why is this so important? Well, we know that that healthcare contributes between 4 and 6% of all global health emissions. Now, we can see it distributed here. There are some countries that contribute a lot more than others. But the thing that I always find frightening is not so much the size of different countries, but healthcare contributes more than all of aviation and all of shipping in the world. Now, that is, when you think of it as an industry in that way, it is huge, and therefore we all need to do something to help manage it. And luckily, as I've just said, there's lots of areas that we can contribute to making a difference. And the important thing to realize, and this is maybe a busy picture, is that the carbon emissions in healthcare, they're distributed in lots of different ways. So there's all the things that relate to the energy that is used on site in a hospital, or the transportation of vehicles, or the anesthetic gases that are used on site. There's also the electricity that is bought from the grid that is part of this, it's scope 2. But then a big, huge component are all the things that we utilize in healthcare that we nearly take for granted. But all the instruments we utilize in the operating theater, the anesthetic gases, the medicines, the food that we, provide patients, all of those different things are part of this, this aspect and to be considered. And so you can quickly see that there are a lot of different places where we can try and contribute to lower carbon healthcare. And in the global roadmap that was developed to look at where some of the evidence is for reducing the emissions, we know there is an awful lot that would be about having clean, renewable electricity, because, you know, we want to move away from fossil fuels, because it's a great source not only of carbon emissions, but a lot of pollution as well. We would want to make sure that most buildings are net zero, and that will be different in different countries and different contexts, making sure that buildings are well ventilated, don't need as much air conditioning, are positioned in the right places, are built with materials that are more sustainable. We also want to work towards better transport systems that are less polluting, that are more reliant on renewable energy, for instance. And I know, you know, having seen some of the traffic that you can get in Indonesia, this is something that will be important immediately for air pollution, but also in the longer term for emissions. But there are a lot of other elements, and I'm going to talk to you a little bit about these other ones as we go forward. Food, obviously, is really key. If we can promote, you know, seasonal, local food in our hospitals, we'll be going a long way to support those processes. And it will also help change some of the agricultural practices and build the local economy to support work being done. But we also can work to reducing some of the impacts from pharmaceuticals. And in this diagram, the red bar is really just the changes from two things. One is from anesthetic gases, because we know that the desflurane that is used in theaters is very potent greenhouse gas and does not necessarily contribute to any greater health outcomes. So anesthetists around the world are beginning to stop using desflurane, and countries like Scotland have banned it completely. And the other one is inhalers, because some of you will know that the inhalers for asthma that have a psht are projected with a very potent greenhouse gas. And so there's a lot of pharmaceuticals industries that are looking at other ways of propelling the medicine into people's lungs, maybe through a spring that will project it better, or other types of gases. Then there is a lot that we can do around, and this is the light green bar, around or trying to avoid single-use items where we can. And there are a lot of examples, and I'm sure you've got some, where some hospital equipment or clinical equipment is being reused, reprocessed in a very safe way, because it might be that it's the manufacturer that does it, or it may be that actually there are some very adequate ways of doing, you know, making sure that they're safe and sterile. And then the way we manage waste obviously matters enormously here, and trying to avoid putting the wrong kind of waste in a community or in landfill is really important. And there's ways of managing waste to avoid pollution, both to the ground, to the seas, but also to communities. And then the last one, I guess, is one we don't talk about much, but it's about having really effective healthcare. And I would put that in the box of quality care. The more we can offer good health to our populations, the more effectively possible, the more we will be contributing to reducing emissions. So anything we can do to improve people's health and prevent illness, prevent complications, will be going in this direction. And that's directly related to quality of care, obviously. Now, when we talk about decarbonizing healthcare emissions, we obviously have very different scenarios between the US, that represent more than a quarter of all healthcare emissions, or a country like Indonesia. But what we do know is that everybody is going to have to decarbonize to get to net zero. And some countries have got a little bit more time to do it, because you may still be growing your healthcare services. And I think that's, clearly countries like the States and Europe have got to move very fast on this, but everybody is going to have to try and get down to zero. And the view at the moment is that we should be doing that by 2050. Now, that's not very far away, and the world has agreed that we should be getting to 50% by 2030. And given that that's just 5 years away, we really have some urgent action on our hands. So really the biggest challenge here is that this is a huge transformational task for healthcare. We need to, put in place actions at every level of what we do in healthcare. And also we need to do that in quite an unequal world, where you will have very different levels of resources. And I'm sure you will feel that in Indonesia, between, very high resourced hospitals and maybe more rural clinics. But actually the opportunities is that there are a lot of great networks like your own around knowledge sharing, to share good practice, or through the IHF. And also this is really about delivering good quality care. So it's very much our core business. It's why we're here and what we're about to do. So what does this mean more specifically for Indonesia? This is a graph that shows the carbon emissions per capita, that's per population. And you can see that in most countries, the emissions are increasing over time. Australia at the top has started to come down more significantly, but you can see that most other countries and the average of the world, are going up. And this is annual carbon emissions of countries. And I just wondered whether you would like to guess in your mind which one is Indonesia here. I'll show you in the next one, but just make a mental note as to which one you think might be Indonesia. And here you've got the answer. I mean, clearly China is, one of the biggest countries in the world, has got very high annual emissions, the US as well, but you can see they're beginning to bring that down. India is growing. Indonesia is there, but growing as well. Sorry, I moved too fast. So every country, even that doesn't have high emissions, will still need to start working on how to bring that down. And it's important because if you think of Jakarta, and I assume most of you or some of you are based in Jakarta, you are vulnerable to sea level rise. And we have got, a lot of modeling that's being done around the world to see which cities are going to be most impacted by sea level rise at different levels of degree changes. So this is, it doesn't show much difference to you with 1.5 degrees, but we're already at 1.4 degrees above the average that we've been on recently. And, so it's becoming quite urgent. And I guess, if we went a lot higher, you would have permanent water around all of your city. I don't know the geography of Jakarta well, but it would come inland quite a lot. And if these pictures don't say much to you, maybe this sort of ranking will. This is the ranking of the most exposed cities currently and in the future. And you can see that Jakarta is number 20 on the list. I am sure you've got other cities within Indonesia that have got similar risks. And the thing that's frightening really is that if you look at the current exposed population, it's high enough. For Jakarta, it's 513,000, but the potential for the future is way, way higher. So, there is something about how we all work as a globe to do something about this, but also how we start thinking about where and how we position hospitals so they're not at risk of flooding and can keep providing services. I don't know if you find this scary or not, but I do. So why does it matter, particularly to healthcare leaders in Indonesia? And I guess, it's particularly important because if you look at the economic side of things, the climate will really impact on the health sector and will have will impact on its ability not only to run services, but also to keep afloat. And so there are some real monetary difficulties here. But at the same time, if, like you are doing, you're discussing how you can take this forward, there's a real opportunity to learn together what needs to be done, strengthen capacity around how to deal with it, and start building more resilient organizations. And I would say that quality of care is very directly linked to making sure that your services are resilient in the face of things happening. And we all know that you are working in Indonesia with WHO and UNDP on trying to make sure that you've got a sustainable national health system. And I think Indonesia has signed up to achieving low carbon or net zero healthcare by 2030. So you've got a lot of alignment within Indonesia about where to take this. So congratulations to you, because there's a number of countries that haven't signed up. Although the number of countries where the Ministry of Health has said we need to develop a low carbon plan and set a date is growing, and there's more and more every month. So what do we mean by low carbon, resilient and equitable healthcare? And I know this is going a little bit further than net zero, but I believe it's important to try and weave these things together. They're all interrelated. So we really can enhance our quality of care whilst reducing the environmental footprint, and we'll talk some more about that. It's about understanding the vulnerabilities in communities that we serve, and some of that might be because of flooding, because of air pollution, because of natural disasters that might happen, or social issues. We need to try and transform all of the clinical practices and operational practices towards lower carbon ways of doing things and more preventative, whilst we build resilience to these different elements. And of course, that can only be done if we've got, a good engagement with our staff, with our communities, with partners, and we develop a real committed leadership. I really believe that it's a leadership competency that people need for the future to know how to tackle this. So I just wanted to touch on, because one of the first reasons people use to say they don't really want to, or they think it's going to be difficult to move towards lower carbon or net zero healthcare, is often because we think it's going to cost a lot of money. And so here I'm just highlighting some examples that people do get a return on investment for what they're putting into it. So, some of these are big scale changes that have happened, like in this reprocessing of medical devices where they've been able to save lots of money, or with Providence where they've changed the types of products that they've bought to make sure they're more sustainable. And whereas in the past they always thought it would cost more, now they really recognize that actually it saves them money. And I'm sure some of you will know about Marks and Spencer's in the UK. When they first came up with a plan for more sustainability in the products that they sold, they thought, well, this might cost them some money. But very quickly they realized it saved them millions and millions by doing it right. So it's interesting that it's a bit of a myth that it should cost money. I mean, there's some other examples here with just, how much money you can save, just like here in France with changing the way you might do things per procedure, or using reusable equipment, or shifting away from desflurane. All of these save money and help improve care. So just giving you another example here from different places. I mean, if you think about, I've mentioned desflurane, but just changing from desflurane to low flow sevoflurane can save an awful lot of money and a lot of carbon. Using reprocessable PPE can save a lot of money. And so now around the world, people are beginning to collect not just examples where they can reduce the environmental impact, but also how much money it can save and how this can then contribute either to go back into having more nurses or more doctors or, managing their hospital more efficiently. So here's again some more examples. These ones are all from Singapore. I would love to have some from Indonesia. So please write and let me know about your examples. But, the amount of things that you can do if you wanted to try and reduce waste, for instance, in eye surgery, how you can, in Singapore, they're repairing some of the linen that they're using in creative ways. And here's another example about trying to reduce the use of desflurane. So there are multiple examples of ways that you can contribute to changes that will make a big difference. Here I brought another case study in, which is from Africa, from Kenya. And what's interesting is that, some people might say, well, it's hard enough delivering healthcare in Kenya. How do you make sure that this becomes a strategy that is part of the hospital every day of the week, every day of the year? And the CEO of MP Shah Hospital in Kenya said, this has really got to be a strategy for 365 days a year. And so they've done a lot of different aspects here. You can see that making sure that they've got good water management and conservation, that they've looked at their green infrastructure, they're trying to reduce food waste. All these aspects have helped them save money. It's helped them reduce their environmental impact, but it's also helped them, the staff, feel better about all the work that they're doing. They have got a more engaged workforce. I've just got another one here on some of the differences, and the one on both of these, which are clinical and relate to quality of care, are quite interesting. I particularly like the one which is around glove use, which was from Great Ormond Street, a children's hospital in the middle of London, where the infection control nurses recognized that a lot of the staff were using non-surgical gloves all the time instead of washing their hands. And so the infection control nurses said, this is not the way it should be. It's up to every healthcare practitioner to make an assessment as to when it's necessary or not. And by raising awareness, they managed to save 5 tons of plastic a year in one hospital. And that's also saved a lot of money. But that's just by implementing behavioral change practices. And I always find that if you think of 5 tons of plastic just for gloves that were not necessary in one hospital, and you try and multiply that to a country, you're really starting to make a big contribution. You can say the same about all of the anesthetic gas changes that can happen in hospitals. And I've already mentioned desflurane, but adjusting to low flow techniques is also something that can be done. So these are all examples, practical examples of what can happen. And what I've been trying to show you is that these examples not only help reduce the environmental impact, they're totally a part of good quality care, and they can save money. So I just want to tell you a little bit maybe about how we propose to help people on this, because it might be things that you can think of as well in your hospitals. Because I really believe that if you're wanting to tackle and move towards low carbon care, there's something about how you support your staff to understand what this is about through learning programs. There's also something about how you can try and assess where you're at on the journey, and then how you can collaborate with others and also, I will talk a little bit about how this links into accreditation and certification. But we try to work on all those different angles to try and help support hospitals and organizations in the work that they're doing. And I really do believe that across the world, we need to work together to raise the standards and accelerate action across the world. And so that's why I'm so delighted that you're having this webinar today and this knowledge exchange. So there is now, with the Joint Commission International, as of this month, their accreditation for hospital includes environmental sustainability now. It's part of a global health impact chapter, and it's a compulsory part of their accreditation. It covers all the things I've talked about. It covers how you track and report on what you're doing, how you engage with your employees, what your use of environmental resources are, how you procure and link into your supply chain, but also about infrastructure and service resilience. And the nice thing about these standards is that they're going to be also open for any other standard setting body to use if they want to. So anybody can use them. So for instance, at the moment, we're just in month 1, and are going to start using the same ones. Anybody else can use them, in discussion with Australia, with Canada, about whether that would be useful. And the idea really is that we don't need to reinvent the wheel, but it would be good if we're all working to the same setup. The other element is that we know that there are hospitals who want to demonstrate that they're doing great work around this. And so there's a certification process now that people can utilize to demonstrate the great practice that they're doing in this space. And we've developed an accelerator tool, which is really a maturity diagnostic for hospitals, where by answering some key questions, you can evaluate where your maturity is in different domains on environmental impact, on social equity and resilience, but also on leadership and governance. And through that, understand how you can improve and then track progress and report to your board on that. So this describes a little bit all the different areas where you might want to, that are covered, and you can see it's quite broad. It's not, there's low carbon care in clinical practices, there's low carbon care in operational services, but there's also making sure that you understand the sort of vulnerabilities of your community, your environment, and what that might mean for future planning. So I'm going to go over this rapidly, but it's really wonderful that Indonesia is very committed to wanting to take forward sustainability in healthcare. And we're really pleased that we're working with Percy to start looking at what a program could look like for training hospital leaders and other employees in this process. And some of what we do is to take people through what it means, understanding what the hotspots are, identifying what some of the benefits can be, and how to develop the leadership competencies around that. And as part of it, we use a carbon emissions learning lab, which is a game where you can trial being responsible for a 500-bedded hospital and having to reduce carbon emissions by 50% within 5 to 7 years. And the true issue here is, how do you do that whilst you balance your budget, whilst you keep patients happy, you keep good quality care, and you keep your staff well engaged on the process. And so that's a game to help try and work on that. And it gives you a dashboard of where you're going with your emissions so that you can track progress, but also try and see if you need to adjust your strategy as you're going forward. And I'm really pleased to say that we've also worked with KSK to develop some modules for their fellows. And so there's several modules to support that is self-paced to support training and around sustainable healthcare and low carbon healthcare. And there's also the ability to utilize this carbon emissions learning lab. So that's all really good, good news. So yeah, we've also training some people in Indonesia who are going to be the people to take forward this program, Indonesia in Bahasa, because I'm sorry, I can't speak it, and nor can any of us at the Geneva Sustainability Center. But we're really delighted to be able to work in partnership with you all on how we take these things forward. I also want to mention that there is a World Hospital Congress every year. This year it's going to be in Geneva in November. And even if the weather is not great, there'll be lots of knowledge sharing. And the abstracts are currently open. If you want to submit an abstract in this space, please do that. We would love to hear from you. And I see that there's a question. Would you like to ask me your question? Or maybe it isn't. It's Mrs. Razmanawati. Do you want to do it later? I'll keep going, and we can always bring it in at the end of what I'm saying. But just to say that it's a really good opportunity to submit all the work that you're doing towards low carbon healthcare as part of the World Hospital Congress. And there are also awards in low carbon healthcare, in social responsibility, so that you can share what you're doing and how you're taking things forward. Oops, sorry. The other aspect where Indonesia has been contributing, and I'm very grateful to you for this, is that there is a lot of interest with the French Development Agency, Aga Khan, and various other organizations in how we can work together to really change the setup in less well-resourced countries like like the States or Europe, and try and combine developing low carbon resilient healthcare models, but also supporting workforce capacity issues, developing quality of care in the right way, and making sure that we address the financing that's required to support those processes. And I think my understanding is that the French Development Agency are working a lot with the Indonesian Development Bank to support healthcare in this direction. So I am sure that there is a lot of opportunities for Indonesian hospitals and healthcare to work with other partners to help deliver the changes that are necessary in this space. And of course, there's a lot of resources that are available on our website that will help you with this. Here and there's just a sample that we've got, but we think it's really important to start by getting your organization aligned and making sure that the board of your hospital is going to take this seriously. So there's how you can do that. There's considerations about appointing a chief sustainability officer, because they can really help lead a program. And then there's a lot of things that can be done. We call them no regret measures, but things that you can do immediately without understanding fully your carbon footprint. Like you can reduce your waste, you can move away from desflurane, you can try and minimize the use of single-use items. There are lots of things that you can get going on immediately if you're interested. And all of these no regret measures, they all improve the environmental impact, but they also improve quality of care, and they all save money in the process. So they're win-win-wins as far as I'm concerned. So I'm going to leave it there, because I'd love to have some conversation with you about what it is that you'd like to find out more. I can give you some extra examples if you'd like, or illustrate some aspects more. So I'm going to stop sharing, and maybe we can pick up some of the questions that are coming up instead. And hopefully we'll see some of you during the course of the year, because we're talking about coming to Indonesia during the course of the year. So thank you very much.
Thank you very much, Sonia. Very nice lecture and very clear. I hope that everybody, more than 100 people here gathered, can have a clear mind, clear idea, clear vision about what's the essential part of low carbon healthcare. Maybe somebody want to ask, please raise your hand.
Ani,
Yeah, please.
thank you.
Pak Sutoto,
Yeah,
please share Dr. Sutoto's picture.
thank you very much, Ms. Sonia, for excellent, inspiring, and impactful presentation, providing valuable insight on low carbon healthcare solution. I have 3 questions for you.
Yes.
First is, considering that healthcare systems are often resource intensive, what specific strategies or technologies can hospitals implement to reduce their carbon footprint without compromising patient safety and quality of care? And second, what are the biggest challenges healthcare organizations face in transitioning to low carbon operation, and how can policymaker, healthcare leader, and international organization collaborate to overcome this obstacle? And the third, given the urgency of the climate crisis, how do you envision healthcare professional roles evolving to include environmental sustainability as a core component of their practice and decision-making process? Thank you very much.
Those are very good and big questions. Thank you very much, Dr. Sutoto. So for the first one, yes, healthcare is very resource intensive and it carries a high carbon footprint. And so some of the strategies, I think, as I've mentioned, is really about looking at or understanding where the biggest resources are, and whether there's any efficiencies that can be used there. So for instance, energy is obviously one of the big resources that's utilized, and trying to move to more renewable energy is going to be good for everybody. And it can be good not just because it's better and it's lower carbon, but also because in certain circumstances it can build your resilience in adverse events. So having your more localized supply might be beneficial in certain circumstances as well. So I mean, looking at your energy, looking at your waste and how you can manage that is really, and managing it in a more sustainable, lower carbon way. And there are ways of doing that can be through, for instance, microwaving or sterilizing the waste before it can be managed more systematically. And it will be different in different parts of I'm sure it might be different in different parts of Indonesia, and I'm not sure whether you've got different regulations there. But so I'd say energy, waste. Then there is a lot to do with thinking through single-use items and whether there's any opportunity for reusable or reprocessable items. And that goes from simple PPE, but it also goes through to laparoscopes, to medical technology, and working with some of the suppliers to expect them to help you reprocess things. I think it also goes to prescribing practice where, for instance, with inhalers or with the use of anesthetic gases, to shift to lower carbon solutions So there's lots of different elements. I think the most important thing, because you asked about the strategies, is to make sure that the hospital or the organization does have a plan, that has a plan that it follows year on year, and it reports to the board what it's doing, and then starts calculating and describing the changes. Because this is something that's not going to be a one-off change. It's going to be something we have to do for years to come, and we're going to need to get better and better at it. So that takes me to your second question, which is the challenges. Well, there's a lot of challenges. I mean, some of the challenges are that we are all so busy in hospitals that it feels like this is an extra thing to think about, and how are we going to find the time to think about it and to include it? And that is a huge challenge. But I do think that with the right kind of setup in a hospital, if it's included in what the board wants to hear about, and there's the right type of support with the right, committees and support, it can really make a difference to people wanting to work on this program. And also, if you look at certain efficiency measures, I think it can save time, it can save money. And so those things can be reinvested in other ways. But it probably does take a commitment to want to do this at the beginning, because it is it can take time. I think a lot of people think it's going to cost money, and I think I've given you a lot of examples that you can save money and improve the environment. But I would say, from a policymaker perspective, which I think was part of your question, there's real we should, as healthcare representatives, have a strong voice about why we need our supply chain to help us. We need the right kinds of products that are more low carbon. We need suppliers that can help us manage our waste better. So to me, there is some coherence that we need across a country, for instance, to help all the hospitals to buy and to put pressure on the supply chain to make sure that we've got improved products over time. But having said that, the example about the gloves, that's not the suppliers. That's about us as healthcare professionals being more careful about how we use things, and that is down to behavior and culture in a hospital. And we also need, that's quite a challenge to get everybody moving in the same direction. And that takes me to, the clinical practice, because how do we support professionals to do this? And I do believe that in every profession, there's some changes that are needed in clinical practice. I believe there's many that can be done without impacting negatively on patient safety or quality of care. And, if I just give you one very small example of a nurse who came onto a ward and said, well, why do we have to give the medicines in little plastic cups that get thrown away? Why can't we use something that we can put in a dishwasher and reuse? There's lots and lots of steps in every aspect of clinical care that we can think through more systematically. And I think it requires the will to want to do that. And I know for anesthetic gases, a lot of the colleges of anesthetists have really, they've taken it on board to change their practices when they realized how bad it was for the environment. So raising awareness is a really, probably the first step, is to let people know that what we do does impact on the environment. And, be it through anesthetic gases, be it because we've got lots of plastic waste, be it because, we're overusing medicines and it's getting into the waters around us. There are it probably starts with raising awareness that all these things are not good for people's health, and therefore it's part of our role and responsibility. I mean, I'm an occupational therapist by profession, and I really believe strongly that every clinician can help make some differences in their everyday life at home and at work. I hope that's helped answer your questions a little bit.
Thank you very much. Pak Toto, still mute.
Thank you very much. Back to you, Dr. Han.
Thank you very much. Very nice question and answer. We have two more questions from Dr. Mirta Vidya.
Yes.
Can you ask it directly, or shall I read it? Dr. Mirta?
Yes, I'm here.
Yes, please. Dr. Mirta, tolong di-share. Di-pin.
What have I to share? I
No,
just
no.
can I just talk?
Indra, tolong Dr. Mirta di-share. Please share Dr. Mirta's video so she can talk directly and we can see. So,
Okay, I open the video. Can you see me?
video, open the video, yeah. Okay.
So wait a minute. So there is a lot must to be done to achieve the low carbon in health services. Of course, it's require a lot of money. According to your experience, what should be done? A little private hospital, so it will low cost, and can we do it quickly?
That's a very good question. Where to get started? And I would just like to start by saying that a lot of things you can do in a small hospital do not cost money. You can save money by doing this. It's the bigger things that might cost money later. But the first thing that I would suggest that anybody can do is to start looking at energy efficiency. You know, how can one be sure that you're using your energy in your hospital in the best way possible? Because we are quite wasteful in healthcare, both in terms of energy, in terms of water, in terms of the number of procedures we do, in terms of the medicines that we utilize. And that can be, I know, if you've got if you can change the temperature on the ward by 1 degree or 2 degrees, can make a big difference immediately to your energy bills and not really have a huge impact on people. The same with switching off equipment at night that is not necessary can do the same. So a lot of hospitals have started with looking at their energy because it's something that people do at home. They understand that the changes that can happen. I think then they are, if you're a hospital that has got operating theatres, I think bringing your anaesthetist into the discussion to think about how they can change the use of anesthetic gases to be more low carbon will also save money. And I think you could get the whole of the operating theatre staff to look at how, I know we've seen in a lot of places that when you're doing procedures in an operating theatre, you might open more than one pack, and then you've got lots of non-sterilized things. So just becoming more systematic about the types of packs that you use can make a big difference as well, and save money because it's efficiency. So I think if you've got the willingness in your hospital to maybe put somebody in charge of starting to drive some of those things, you can make some quick differences and you can do it saving money. And if you can put the money you save into a pot to invest into future changes, then that would be amazing.
Yeah, thank you. Can I ask one question, please? Okay.
Yes.
you said in your presentation, one way to reduce waste by using recycle, for example, gloves. And how about the equipment for hemodialysis? In Indonesia, before we use recycles, and just last year we use single use. It could be huge waste cost of it.
So you are right that there's a lot of procedures where we could move from single use to reprocessing. And I think it depends a lot on your supply chain. But I know there's a lot of hospitals around the world that work with their suppliers of different elements to really say, can we guarantee that it's going to be safe, that we can manage the infection risk? So for instance, with laparoscope being able to, it's the company who takes them back, reprocesses them so that they're safe to use and there's absolutely no infection risk. And I think with hemodialysis, there's people that are doing that, but it would be best to check with your supplier. And I think one aspect is for every hospital or for every hospital association to say, we expect to have these discussions with our supply chain. We want to move to low carbon healthcare, and it will mean that we have to do these things together, because then it's a stronger voice you have. Yeah. So I can't answer specifically without knowing your products, but it is happening around the world. Yeah.
Okay, thank you. Thank you, Dr. Hani. Thank you.
Sonia, I want to extend the questions from Dr. Mirta. Is plastic waste doing with low carbon?
Yes.
Yes,
So,
yeah, sure. Huh?
So yes, producing plastic is very carbon intensive because it uses fossil fuels. It's also very difficult to deal with it as a waste. It's cost intensive and difficult to use as a waste. So we should be seeing plastic as an extraordinary resource that we should be saving and reusing as much as we can. But we've become very used to plastic now, and we use it and throw it out. So it is absolutely part of low carbon healthcare to reduce the use of plastic or to change the use of plastic. You're right. And maybe I should have said that more strongly at the beginning.
Yes, maybe GSC, Geneva Sustainability Center, can push WHO to make a special
announcement on that.
waste.
Yeah.
For that must be a bait in the whole world, maybe something like that.
Yes, so the whole world can do that. And actually what's interesting is in some places they're starting to use the plastic to make other products. So you can buy clothes that are made out of recycled plastic bottles, for instance. Everybody's trying to be creative around it, but reducing plastic waste would be amazing and really, really important to do. Yeah.
Yes, thank you. Ibu Kemalarita, she's a nurse, a very brilliant nurse from the Heart Hospital. Please pin Dr. Kemalarita, Ibu Kemalarita, please.
Thank you, Dr. Hani. Thank you, Sonia, for your good presentation. Give us a new insight about the carbon dioxide. I have two questions for you, but one occasion Dr. Mehta has asked to you about the effort that can be made to reduce the carbon dioxide in hospital, include implementing implementing reproduction medical devices, like Dr. Mehta asked to you before, switching from single-use to reusable, and yes, like equipment of hemodialysis, But now in my hospital now, we we push the management to use the single use.
Oh,
Oh, but
yeah.
wow, I'm wrong during this. Yeah. And how about in terms of transmission of infection control and safety of the occupants? And the second one, to reduce the carbon dioxide production in hospital must be started, yeah, simultaneously and integrated in hospitals. What are the steps the hospital must take to start this movement? Yeah, to start. Thank you, Sonia.
Thank you. Very good questions. So you're right, with everybody always worries about infection control with reusable items or reprocessable items versus single-use items. But in the olden days, when I was younger, we used to have desk autoclaves that we could utilize to re-sterilize things. And in some parts of the world, the suppliers are being asked to say, we don't want to buy single-use items all the time. It's good for the suppliers. It's good for them to sell you single-use items. But we can ask them to do things differently. And I won't say that it's a blanket approach, because for each item, you need to go through and check that it works with what you've got available. But we can all say to our suppliers, we want safe, reusable items that are not going to put infection control at risk. And in a way, that's what the whole glove story was about, was that we've become so used to having single-use items everywhere. It's more for the supply chain's profit than anything else. I worked in a hospital where we suddenly said, we need to have single-use curtains around the beds. Well, we didn't really. We didn't. And it was maybe cheaper per unit, but overall, it was still cheaper to have curtains that you could wash well. And, so I think sometimes we need to re-question why we're doing things. Yeah. And I do think it's not just about the hospital to take the risk. I think it's the hospital and the supplier. So like with all the hemodialysis things, it's about saying we want changes to this. We would like to, and maybe you have to give them some time, but we would like products that we can reutilize, that are going to be lower carbon, that are going to use less water, that are going to be easier to manage into waste. Because if we don't tell them, they're not going to do it, I think. Yeah. I hope that helps. And I've gone and forgotten your second question, which is what can you do that's easy? I remember now. I do think that starting to talk to your staff about these things is really important. Energy efficiency, but also making sure that you are, not overusing all the tests, diagnostics, that we're looking at good value healthcare. There's a lot of things that we do in healthcare sometimes that don't really add value to the patient journey. And we need to be good at recognizing those. I know there's a lot of countries now that are putting a lot of focus on that and prevention.
Thank you.
Yeah, thank you.
Burita, are you satisfied?
Yeah. Thank you, Dr. Hani. Thank you, Sonia.
Thank you, Sonia.
Thank
No.
you.
So very, very nice lecture. Can maybe I close with some questions?
Hani?
You've got Dr. Nico who's got a question.
Oh, Dr. Nico?
Yes.
Please,
Dr.
Nico
Nico,
first.
Dr. Hani.
Okay. Thank you, Dr. Hani.
Yes.
Mrs. Rosnick, thank you for your remarkable, very important presentations on low carbon metals. I have two questions, simple questions. The first one is very basic. We know that the healthcare world consists of two phases: promotive, preventive for the community, and curative, rehabilitative for the sick people. So, what can you describe the impact if the government focus mainly or more to the preventive, promotive side rather than to the curative, rehabilitative side? That's the very basic question. Number two, going to the curative sides, patient care in hospitals. How can the healthcare system effectively balance the need for changing the methods in patient care, like patient-centered care, etc., and the long-term reducing carbon emissions? Thank you.
Thank you. Those are very good questions. So, of course, the more you can put in health promotion and prevention to avoid people needing curative care, the better it will be for the carbon footprint. I mean, I think we've got it wrong. I don't know what the statistics are in Indonesia, but in Europe, 4% of healthcare costs is in prevention. And so we're waiting for people to get ill and come to hospital and then treat them when we could be putting more effort into helping them be well beforehand. And there's a previous chief executive of the NHS who wrote a very good book. He'd obviously managed healthcare in the NHS for a long time. And he said, health is made at home, hospitals are for repairs. And really, his main message was exactly what you say. We should put more effort into prevention and health promotion than what we do at the moment, because otherwise we've got the balance wrong. I think that's very true. On the curative side, though, I also believe that low carbon care is very consistent, or it's aligned with patient-centered care, with high value care, or making sure that we don't waste resources on the wrong things. It's absolutely part of the same thing. And I think if we think of it as these are all pillars of quality of care, then it helps to integrate them. And we did some work before where we said, well, quality of care is about patient safety, clinical effectiveness, it's about patient satisfaction. Those three things are things that are important in the immediate, but there's also pillars about social value, good value for money, about sustainability or low carbon, and equity, that are all also pillars that support that. So I feel as though it's about balancing those out and doing them together, and that it's easier to achieve the change if you bring them in together as part of the same thing. That's why, for me, low carbon care and resilient care is all part of quality of care. Does that help answer that one?
Yes, thank you, Ms. Rosnick. I am one of the member of the management of CARS, but also my feet is also in Persi. I initiate patient safety in Indonesia. Thank you.
Fantastic. Congratulations.
Dr. Nico is the patient safety father in Indonesia.
Fantastic. Well, good patient safety is also sustainable care.
Yes, thank you.
Yes, thank you. I have some questions about our lower economic countries.
Yes.
How can lower economic countries effectively leverage local resources, traditional practices, and community-based innovation to implement sustainable and low carbon healthcare solution in a cost-effective ways?
So
one is about global support. What role should international organization, donors, maybe WHO or something that you can imagine, to and developed nations playing in supporting lower economic countries to transition towards lower carbon healthcare system. How can this partnership ensure equity and long-term sustainability? Maybe.
Well, it's a really good question, and it's a really important one. So there's two aspects to it. One is I believe that the whole world and all the money that is being put towards climate change needs to go to also supporting the changes that are needed in healthcare. So that could be the Global Climate Fund, it might be money that the WHO can access, but it's also the development banks. They should really help healthcare move in the right direction. And, that will be about making sure that, I always say a hospital should be the last building standing in the case of an emergency or a natural disaster, because you want the community needs to be able to rely on it. It would be good if the community could also use that building to charge up their phones if they needed in an emergency and so on. So there's a real support that is required to change. And at the same time, I think that there are solutions that are visible in lower resource settings that actually the higher resource places should learn from. So, I know that, for instance, there's been some comparisons made between cataract surgery in India in some settings with cataract surgery in the UK. They've had the same clinical outcomes, but in India, they've been able to do it with 90% of the carbon footprint. 10% of the carbon footprint, so 90% less of the carbon footprint than in the UK. And so there are solutions that are beginning to come about that we need to showcase to the UK, to US, to Europe, that there are ways of doing it which are much better, that we all can learn from. So I totally believe that there are some good local, low resource, local economy solutions that can be made in each country. And during COVID, we saw some fantastic examples of hospitals or countries that had to be very creative about how to deal with different problems. And, we need to do more of that.
Yes, thank you very much. Now, Ms. Sonia, it's very, very amazing talking with you. And it should, I close the session, but
Hello, Hani.
Yep.
May I present one picture to show to Ms. Sonia?
Yes, it's a
please,
wonderful
Sarah.
picture.
Yes, not my picture, but this picture I got in Istanbul meeting of ISQA.
Yes.
So this is a woman with two big operation, maybe cesarean and breast cancer or not.
Yeah.
They spend all the material around here,
Yeah.
glove, suture and gauze and everything. So this is is it problem with low carbons?
Yes, of course. So this is, I love this picture, and I think it's John Perlin who showed it in Istanbul, isn't it?
Yes, yes.
Yes. And it's a very good illustration of the
Yes.
amount of waste.
Very impressed.
Of the amount of waste that we generate in healthcare. And yes, this is a low carbon problem, because if you think of the fact that 70% of the carbon footprint of healthcare is in all these things, it's all the things that we utilize. So everything that we utilize, we need to be trying to reduce or to reuse. And this is a perfect illustration that this is part of the problem. I think in Europe, they say it's about 4 kilos of waste per patient per day. I think in the States, it's 10 kilos. And you can understand it completely when you see this picture. So reducing waste and managing our waste is hugely important. Just like reducing and managing our energy is hugely important. Yeah. Thank you for showing that picture. It is very powerful.
Yes, I'm very impressed with this photo. So now we try to reduce our material for every operation because I'm a surgeon. Yes.
Well, if you can do that, that is the best thing you can do because there is so much, and you will save money for your hospital and
Yes.
save carbon. All
Yes.
of it is directly related. Yeah,
Yes, this
excellent.
related with Miss Rita Kamala
Yes.
asked you before. Yes.
Uh,
Okay, thank
Ms.
you, Sonia. Thank you, Sonia.
Dr.
Ms.
Nico?
Rosnick, continuing this discussion, I think there are two phases for the expressions. Health is not everything, but everything is nothing without health. So the positive side there, but the negative side, the low carbon.
Also there, negative also there.
The
Yeah.
negative side
Yeah.
for low
Yes.
carbon. Yeah.
That's right. And I believe you can do both well if we want
Yes.
to. Yeah.
Yes.
Hopefully.
Yes.
Thank you.
Yes, okay.
Yeah, thank you, honey.
Amazing. Sonia, have some, we are going to change the schedule. We are going to make the Zoom polling with 5 questions. So we know the answer, which one is right and wrong. So you can
I
see
can comment.
then we close. Okay.
Okay, that's lovely.
Okay, Indra. Dear friends, dear ladies and gentlemen, please answer this question quickly. And the people who got 80% answer right, 4 from 5, they will get an international certificate for attendance. Please answer the question directly now. 10 minutes time. Then we can see the result directly. Silakan teman-teman. 5 minutes more, dear friends. Pak Indra, how many percent has answered already?
Baru 44%, Pak.
44%. Come on.
Halaman keduanya hilang tuh.
Halaman keduanya ada,
Hilang ya, nggak keluar, nggak muncul lagi.
Pak Indra. Soalnya hanya 2, Roswita Setompul. Halaman
Iya,
keduanya nggak muncul, Pak Indra. Kenapa? Di saya muncul.
di saya nggak muncul.
Di saya juga nggak muncul.
Ya, udah di chat tuh semua banyak kan.
Di share ulang coba. Try to share it once again, Pak Indra.
Nanti yang udah
My
jawab
computer is
hilang
okay.
semua, Pak.
Oh,
Yang
hilang jawabannya.
jalan tuh
Oh, kalau udah klik submit hilang ya?
Ya, ya.
Oh,
Indra,
Saya ada 55.
hilang kalau
Di saya ada 55-nya.
ya udahlah.
oke.
Okay, yeah. Shall we stop in 2 minutes?
Ya,
So Sonia can see the answers. Dear friends, I hope this opens your mind about low carbon, and you can make abstracts for Geneva and for Brazil, ISQA, about sustainable healthcare,
Yes, please do.
sustainable low carbon healthcare in your hospitals or in your country or in your region. Pak Indra, let us stop and show the result.
Ya, oke.
Keluar persentasenya nggak? This is the right answer.
Iya, keluar, Pak.
But the percentage of the graphic. Can you show the graphic?
Oh, nggak di grafik, Pak. Dia di baris kayak gini aja, Pak.
Oh, nanti nggak keluar yang jawab A, berapa B, berapa C, berapa gitu.
Ini keluar.
Biasanya bisa.
Yang sekarang keluar, Pak.
Hah?
Yang sekarang kan keluar, Pak. Garis biru itu kelihatan nggak, Pak?
Garis biru.
Belum.
Sebentar.
Ini soal aja nih.
grafik gitu.
Anda
Oh,
yang seperti
ya.
Pak Joti itu.
Biasanya jadi keluar barnya gitu. Ini garis
Ini
biru
bukan
apa?
Nah, ini jawab.
Your result.
Iya, Pak. Ini kan result semua, Pak.
Masing-masing.
Semua, Pak.
Oh iya, lain model sih
Pak.
ini ya. Bukan kalau Pak Joti kan satu pertanyaan dijawab rame-rame gitu kan.
Ya, ini enggak,
ya.
Pak.
Beda-beda ini.
So it's a little it's or for the next lecture. Okay.
So we make a little mistake, Miss Sonia.
In the
No worries.
Zoom,
Yes.
we cannot see the graphic.
Yes, we cannot see.
No,
Later
that's
we
okay.
are going to. You inspire
Okay.
us too much.
Okay.
Okay,
For the
then,
next.
ladies and gentlemen, what an inspiring and thought-provoking session that we just have. On behalf of everyone here, I would like to extend our heartfelt gratitude to Ms. Sonia Rosnick for sharing her profound insights on why low-carbon healthcare truly matters.
Yes.
Her words have not only illuminated the critical connection between health and sustainability, but also empowered us with actionable steps to make a difference in our own organization and communities. From the innovative strategies she highlighted to the urgent call for collaboration, Ms. Rosnick has reminded us that creating a sustainable future is not just an obligation, but an opportunity to redefine healthcare as a force for global good. And as we leave this session, let us carry forward her message that every action we make today can contribute to a healthier, greener, and more resilient tomorrow, whether it's through reducing emission, optimizing resources, advocacy for changes. We all have a role to play in this vital journey. Thank you, Ms. Rosnick, your leadership, vision, and dedication. And thank you to everyone here for being a part of this meaningful conversation. Together, we can and will make a difference.
Sekarang Pak Toto nggak mau lagi nutup udah lah.
And let's continue to champions to cause low carbon healthcare. Thank you. God bless you, Mr. Rosnick.
Thank you so much, and congratulations to you all on the work you're doing. I look forward to seeing it translating into abstracts and to seeing the impact you have. So thank you very much.
Yeah,
thank you.
Dear friends, until 112, please inspire abstract February, end of February, it's closing for Brazil and for Geneva. If Brazil is too far, you can go to Geneva and
yes.
Keren.
Okay. Let's open the whole population. So Sonia can wave to everybody. Tolong dibuka Indra semua. Open semua.
Thank you.
Yeah, okay.
Thank you, Sonia.
Thank you, Sonia.
Thank you so much to you all.
Thank you, Miss
Thank you,
Sonia.
Thank you, Miss Sonia.
Thank you.
Thank you all.
Miss
Thank you for your
Sonia.
work.
Thank you very much. Thank you.
Ayo,
Bye.
begin ini ya.
Thank you,
Make your
everyone.
abstract.
Yes.
Thank you,
Terima kasih, Dr. Joni. Terima kasih.
Ya.
Okay.
Yes,
Now
terima
begin.
kasih.
Joni, Dr. Hani.
Night.
Sehat selalu.
Bye-bye. Thank you.
Eight.
Terima kasih. Sehat-sehat
Assalamualaikum.
semua.
Bye.
Terima kasih.
4, 3, 2, 1, 0.